Good morning, everyone.
Morning.
I'm going to share my screen with you. And then I'm going to ask if you can see my opening slide and if you can see my face still. Yeah, we're good?
Mm-hmm.
Okay, sweet. Well, good morning, everyone, and thanks, Kathy and Ellen, for inviting me. I really enjoy any and every opportunity that I get to interact with this work and the organization. I really value it, and I'm going to talk a little bit more about why. But I'm also going to just introduce you to myself, to Community Shelter Board, to the mission, and kind of give you an update on the state of homelessness. And I'm excited for the opportunity to do that. My name is Sara Loken. I have spent my entire career in the homeless services sector. I have children in Pickerington schools, and I'm a student of service learning myself. So this all comes together really nicely for me. I am with Community Shelter Board, and if you haven't heard of this organization before, it's our job to lead the coordination and the collective community effort to make sure that everyone in Columbus and Franklin County has a place to call home. So we oversee all the shelters, prevention programs, street outreach, and housing programs in the homeless system. We are responsible for doing all the strategic planning around those services, budgeting, data collection and analysis, and more. We manage the lease up of some specialized housing for people who have experienced homelessness, and we are the conduit for all public funding for homelessness at the local, state, and federal levels. So you'll see on this slide, if you haven't heard of Community Shelter Board, you have probably heard of Volunteers of America or Faith Mission or Huckleberry House. So we have 17 partners across the community who actually deliver the services, kind of boots on the ground in the field. And we all work really, really closely together. And this collective network of agencies served 15,000 people last year that had an experience with homelessness. And that's just in Columbus and Franklin County. In Columbus, we really are living in a growing community, a fast growing community. So leaders here are projecting an additional 1 million people are going to populate the 7-county region of Central Ohio by the year 2050. Just in Franklin County alone, where probably most of us live, we're projected to grow by nearly 400,000 people by the year 2050. So as the population grows, so does the number of people who experience homelessness. 1,700 more people have become homeless since 2010, and the majority of that increase in homelessness is just because of population growth alone. The trouble with population growth is that in our community, there's not enough housing for everyone, and rents are rising in Columbus faster than the national average. That brings me to really wanting to point out some of the common misperceptions about who is homeless and how that happens to somebody. You may think of homelessness and think of someone that you have encountered panhandling on the street. And that's certainly legit. But in our community, the majority of people who are experiencing homelessness and showing up at a homeless shelter are actually families with children. You don't see them necessarily panhandling on the street, but that's the majority of who is homeless. And I encounter in my work a lot of misperceptions about how homelessness would happen to someone. There certainly are stories of people who have experienced drug addiction or had a really serious kind of health problem or mental health challenge that kept them from working and being able to take care of themselves. But most often, I'm encountering in the shelters people who are working full-time, but are making minimum wage and actually can't afford the typical apartment in Columbus. So, you know, it's not always what you might expect. And I think that's a really important thing to understand. You know, the kind of housing that we need for, unless we're going to address in our community the minimum wage issue, we need more affordable housing, which is just housing that can be afforded based on the current wages in any given area. In Columbus and Franklin County, it's been quantified that we have a shortage of about 54,000 places for people to live who need that affordable housing. That's a giant gap. In the meantime, it's more and more difficult for poor people to find housing, as I said, because in our community, average rents have increased 38% over 5 years, which is really dramatic. There's research that shows that an increase in rent is associated with an increase in homelessness. That's based on some national research. And then in our community, we also have an eviction problem. We've got higher eviction rates than we should in Columbus. And an eviction really creates a major problem for a family or an individual because it places kind of a stain on that record. And a little known fact that really surprised me is that even having an eviction filed against you for, let's say, non-payment of rent or late payment of rent if something really terrible happened, like a global pandemic. Having an eviction filed, even if you manage to scrape together that money and repair the relationship with the landlord and avoid that eviction, that filing is on your credit report for perhaps ever. And you know, an apartment community or a property manager who you are filling out an application with 10 years later to try to move, that rental property manager is looking at your credit report and is not savvy enough to be able to tell the difference. And neither am I, that was an eviction filing and not an actual eviction set out. And so people who've even had evictions filed against them are being turned away and closed out of housing options when they go into the rental market. That's a major problem. I also want to talk just a little bit about what has happened with the global pandemic with regard to homelessness, because this has not been obvious to everyone that I speak with. You know, we've all, especially you all, have experienced major implications in the way you do your work as a result of the economy being shut down and during a stay-at-home order, something so dramatic that has never happened before in our lifetimes. And I think it's been a common experience to kind of check in with each other and say, how has this affected your work? And I've thought a lot about your work. You may have not thought much about my work, or somehow some other social service industries have been affected. But in the homeless system, you know, on a good day, we are working to prevent homelessness whenever we can. And if homelessness does happen, we work to respond really quickly and respond with programs that help people get back into housing as fast as possible. So it's all we do. We prevent. If it does end up happening, we respond with housing as quickly as we can. No matter the program, no matter the clinical setting, no matter the situation, we're focused on prevention and then a really quick response focused on housing. So with COVID, we are taking the same approach. We're working really hard to prevent the spread of illness wherever possible among people who are homeless. And if someone who is homeless does get sick, we have to respond really quickly with isolation and quarantine. I want to show you these images of what shelters look like if you haven't been in one before. They're extremely crowded, congregate settings by design, because of course that's the most efficient thing to do. But when you think about a stay-home order and where you have been since March, imagine being here and this man coughing on you while you lay in the bed next to him. This has presented a significant challenge for us and has frankly been quite scary. This is another dorm where you see folks are bunked up. There are two people in these bunk beds right here, and they're in a dormitory that looks like this. Those beds are really, really close together. This is a dining area. This is how close people are together eating their meals. This is a men's shelter, and here's a family shelter. Again, where we've got congregate settings and people sitting very close to one another to eat their meals. So this is a breeding ground for illness. This looks probably like your school's cafeteria, which was shut down immediately, right? Because this is not safe for kids to be this close together during rampant illness. We can't shut down homeless shelters. If we did, there would be roughly 1,200, 1,300 people on the streets without access to places to wash their hands or sleep or have access to food. And frankly, all the soup kitchens and feeding sites did shut down. All of the libraries did shut down. All of the rec centers where someone could normally go to use the restroom and wash their hands shut down. The only thing that stayed open was homeless shelters. And the reason that we were able to do that without having rampant spread of illness was that we expanded, and we had to act really quickly to figure out how to achieve CDC recommended social distancing in our homeless shelters. And it was only possible to do that by taking over some other facilities. So what you're looking at here is the gymnasium at the historic YMCA downtown building at 40 West Long Street. And these mats, although they do not look terribly comfy, are 6 feet apart. And so this is a safer environment in which people who have no better option and have no home to stay home in, a safer place for them to be with definitely stepped up cleaning and things happening in the space to keep it safe. This is Sullivan Gardens Rec Center, which was closed because of the pandemic. And we worked with City Parks and Rec to take this over and again, set up accommodations for roughly 100 more people to have a safe place to be socially distanced while they are homeless. We set up between these multiple facilities, I'm just showing you 2 of them, we set up 250 beds outside of our normal shelters to achieve social distancing. And this allowed us in some of those other crowded shelters that I showed you to spread those beds apart, to unbunk the bunk beds and really have safe accommodations in all of our facilities. The other thing that was really important that we had to do was when someone does become ill, they can't stay in any of these facilities, even if the beds are 6 feet apart. We had to find a way, a safe way to provide isolation and quarantine for people who were sick or exposed to the illness. And so we achieved that through the use of a motel, which is open right now. And we currently have 5 patients being treated in a medical setting of a motel, which was a completely new effort for us. We don't have medical facilities, but this was an expertise that we had to acquire really, really quickly. And it's interesting, during a stay-home order, you can't actually stay home if you don't have a home. And these facilities for isolation and quarantine were really, really important because they are for people who are not sick enough to be in the hospital, but they have tested positive or they have been exposed. If they had a home, they would be home resting on the couch and eating soup and kind of taking it easy for a couple of weeks while they get better. They don't have a home. And so we had to find a place to put them where they're not going to infect other people, but they are able to recuperate and return to health and then get back to the business of finding a place to live. So right now we have 91 motel rooms for isolation and quarantine. I want to say so far our peak has been having about 30 of those motel rooms in use. on any given time. And right now we've got 5, as I mentioned, five patients, one of which is a family in isolation and quarantine. Going forward, you know, this is a marathon and not a sprint. It's not going to be over anytime soon. We're trying to do the kind of planning that you are doing right now to figure out what this new world looks like, and you know, how you're going to teach in this new environment. We're figuring out how much worse is it going to get, and how do we need to be ready to respond to perhaps more incidences of homelessness, with rising unemployment rates, with a backlog of evictions that are going to be filed and actually processed. And the Los Angeles Times is predicting that as we see unemployment rise as a result of the pandemic, we should expect a significant increase in numbers of homelessness across the US. So we're doing a lot of planning to try to ready our system for that, focused on not building more shelters to respond to that need, but focusing on stepping up our prevention efforts and making sure that we're really well prepared to rapidly rehouse people who do become homeless as fast as possible. And we're actually looking at purchasing a motel so that we own it and don't have to deal with like a long-term lease. Because especially as the economy reopens and as motels reopen, it's harder and harder to find places to do safe isolation and quarantine. So this is expected to go on long enough that we're actually thinking about purchasing our own motel, and ideally, when the pandemic ends, converting it into some sort of housing for the people we serve. I want to say a few words about why I value work with teachers and students, and why Community Shelter Board values work with teachers and students. As I said, I'm a student of service learning, and it really shaped my path to go into the homeless services sector in a very literal way. I think that the work that you're doing around service learning really leads young people to a connection in civic engagement. And that is quite literally the only way that we're going to make progress on big problems like homelessness, like hunger, like poverty in our community. Everyone has to care about it. This kind of work, marrying educational curriculum with community-based work and focus on others, really creates empathy in our students, and you know this, which is why you're taking Kathy and Ellen's courses. It opens people's eyes and hearts to problems that might otherwise be invisible, especially for those of us kind of living far enough away from the downtown core that we don't have to see these problems every day. We can come and go from work and school and from the grocery store and not encounter too many people that look terribly different than us. And that's a problem. That's a problem, quite frankly. And so I really, really value the work that you are doing to bring these invisible problems in front of your students and have them not be able to say, I've never heard of that before. I never thought about a family not having enough food before. I never thought about what would happen if my family was not able to live here, and where would we go? As teachers, you're really helping us reach the masses to help grab the attention of people who need to care about these issues. And your students have networks in neighborhoods that we can't otherwise reach. At the Community Shelter Board, we are a fundraising machine. And I'm really proud of who we're able to reach and what we're able to raise, but it's endless. It's a never-ending job, and it's a pound of flesh for every dollar that we raise. And your students have access in places that we can't reach otherwise. We've had some really fantastic response during the pandemic. And you know, one example I want to give to you of a service learning opportunity that I think is so rich with connections is the need for masks. And we've had a lot of groups take this on for us. But homemade masks can be tied to an awareness campaign about homelessness, with students educating others, saying, did you know that 3,000 children were homeless last year in Columbus shelters? How many masks can you collect from neighbors on your street when you think about those numbers? It can be tied to research about rates of infection in Franklin County or in the county in which a student lives. How does social distancing slow the spread of the virus? That's great research and knowledge for students to acquire. I think it would be incredible for students to pursue new techniques for no-sew masks. I've seen some pretty simple DIY videos on YouTube, but I'm sure there's more. There's so many fascinating products out there, and not all of us sew. Some of us are learning to sew because of the need for masks, but I know there are other techniques out there for how masks can be made really simply without a sewing machine. And then obviously, like math and budgeting for fabric and other materials, that definitely can go a long way being tied to curriculum. Just one example, there have been so many opportunities and so many young people that have stepped up and helped us out. You see a sweet family here who helped us with some snack packs for our efforts to feed people while all of the soup kitchens have been shut down. So I just want to thank you. I just really, really want to thank you. I'm amazed to see how many people are in the session today, how large your numbers are, the enthusiastic levels of interest. This is a really powerful and creative network that I'm proud to be part of, that truly inspires young people to build better communities. So thank you.